Today we're going to talk about parathyroid carcinoma. It's a very rare diagnosis. Usually, majority of these patients have very high levels of calcium. Very rarely, these tumors can be asymptomatic. Usually, the patients have symptoms from hypercalcemia. Preoperatively, you can use an ultrasound and a system scan to localize these tumors, but usually it's a more of a clinical suspicion that you're thinking about a parathyroid carcinoma because it's so rare. Should you do an FNA or a biopsy? The answer is no, because the diagnosis of parathyroid carcinoma is based on invasion. So, what operation are you going to do? You are going to remove that parathyroid gland en-bloc, which means you're going to remove that part of the thyroid lobe on that side to make sure you have an R0 resection, because that's the only way of potential cure. What if the tumor is invading the recurrent laryngeal nerve? You would have to resect the recurrent laryngeal nerve, and I hope you have had this discussion preoperatively with the patient. So make sure you do an en-bloc resection, and the pathology results would show that there was invasion into the surrounding structures and it was a cancer. So you do not necessarily need to send it for frozen. Radiation and chemotherapy, they generally do not work for these patients. What is the cause of death in these patients? Now, these patients will need recurrent operations because they would have recurrence, if anything, but the cause of death is that they succumb to the manifestations of hypercalcemia. Thank you.